In this video, we're going to demonstrate how to do a muscle energy technique to correct for unilateral sacral flexion. So in unilateral sacral flexion, we have a dysfunction on just one side. The sacral base will be flexed, so it'll be very deep compared to the other side, so it'll be very deep. And then unilateral sacral flexion, we have this unique phenomenon in which, because the sacrum has done that, the ligaments over here at the ila will become extremely tender to palpation. So if you're able to find the ila and palpate the ila, it'll be prominent and it'll be very tender. So that's some of the hallmarks of unilateral sacral flexion. Sacral base is deep, ila is prominent and very tender, and that tenderness is unique to unilateral sacral flexion. So since the sacral base is anterior and the ila is posterior, we're going to kind of create a little seesaw here. I want to push the ila anterior. I'm going to bring the patient's leg outside my body, and I'm going to drive the patient's leg into internal rotation to lock out the hip on the pelvis. Right there, the pelvis starts to move. Okay, so I'm going to lock out the pelvis using the hip. I'm going to provide a posterior to anterior force at the ila. Then I'm going to have the patient push their leg into my body. So I want you to push your leg into my side. 1, 2, 3, 4, 5, 6. Relax. We're going to move the leg into more internal rotation. Push into my side. 1, 2, 3, 4, 5, 6. We're going to move it into more internal rotation. Push into my side. 1, 2, 3, 4, 5, 6. And we would do a couple of sets and repetitions on that. Because of the nature of unilateral sacral flexion, you can also attempt a long axis distraction. We can also do a side lying SI manipulation to correct the unilateral sacral flexion.